Today we're going to be talking about Counseling Center administration. Now, what have we done so far? We've come up with your mission, your vision, your dream. Then we came up with a plan last time, and now we have to start implementing that plan. And I'm going to suggest to you it's sort of like building a house. You might have the total plans for the house, but what do you have to do when you try and build a custom house? You got to make all these decisions. I mean, you got to figure out what color the carpet's going to be, what color the walls are going to be, how you're going to decorate the house and everything else. And all of those decisions are going to have an effect on the overall feel that you have for your counseling center. And this is important because the Bible tells us what? We're to do everything as unto God, and we are representatives of God, right? We're ambassadors. And because we're ambassadors, whatever you do in life is going to reflect on how people see God. That's why it is important for us to figure out all this stuff and come up with ways of doing it that we feel are honoring to God. So when people come into our counseling center or our practice, that it feels like a place where God should be, right? Because you can get very different feelings as we go through things today and we talk about some of the different forms and some of the different things. You can get a very different feeling by the choices you make. In the weeks to come, how you choose the software you might use, or how you choose to decide to do different things and make different choices are all going to reflect your counseling center and eventually reflect God and what people feel about when they walk out of that. Because hopefully when you're counseling, you're allowing God to live through you and to work through you and to express Him in your whole center, and how you administer your center is going to make all the difference. How many of you ever come into a place and the people are all grumpy? And the people won't do anything, and they have these set rules, and everything is totally legalistic, and you can't do anything, and you can't get anything accomplished, and no one will answer the phone? Is that the way we think maybe God's center should be? I hope not. But some places that call themselves Christians, even some churches, that's the way it operates, and that's what it's like. Now we also have to realize that we're going to have some limitations here. Because in the ideal center, and we're going to talk about that together, of how you'd like to have this and this and this and be set up this way, how many of you think that's going to be the way it's going to be in the church that you're operating out of? What are you going to have to do? Make things work the best you can and then grow and eventually get the things you need as you get there. I think it was Zig Ziglar that said, do things poorly until you can do them better. And we don't want to do things poorly. We want to do them the best we possibly can. We want to look at that all today. And as part of all that, I'm going to give you some forms and so on to look at, to understand what we're doing here. Does that mean you have to do what we're doing here? No. It means you need to do what God is telling you to do to make your center the way He wants your center to be. But I'll give you an idea what conclusions we have sort of reached. So first, what is the minimum administrative support and equipment that you need to even get started? Well, first you need a phone, some way of people to get a hold of you. And of course the good news is today with cell phones, you don't have to have somebody here 24/7 doing everything. You can have somebody answering on a phone. Of course, if you're in a large church, what are they going to already have? They're going to already have somebody answering the phone, and maybe you can let their person do your appointments and do those kind of things for you. Another thing you're going to need is a locking file cabinet or some way of locking up your records. The other thing you're going to need is 2 chairs, one for you to sit in and one for your client to sit in. When I took my practicum at WSU, they had all these small little rooms. I mean, they were like 8 by 8 or maybe 10 by 10. And all that was sitting in these rooms was 2 chairs. And of course, they had one-way glass so the instructor could watch you and so on and so forth. But that was what you counseled out of. And you need a room that has a certain amount of confidentiality. So that's your basics. But we want a whole lot more than that if we can get it. So let's talk about what a counseling center should look like when you get your chance to put together your ideal center. The first one is soundproofing. Whatever room you have, you want to have it soundproofed. We got our chance after a number of years that we got enough clients sitting in there that the pastor's waiting room was all taken up by our clients. And so they finally decided to make a change and take one big room and modify it into a counseling center for us. And the first thing we did is we put a requirement in there that when they changed the rooms, that they would put 3 layers of plasterboard with a sound dampener in between it. And that the doors would all be solid doors. And they would even have a little thing in the very bottom that when the door closed, it would put a dampener across the bottom of the door. Now, I wish we had put some more insulation on the ceiling because we don't have it exactly perfect the way it is, because the sound can still come through the drop ceiling to a certain degree. But once you have it, that's what you need, is some sort of a sound dampening situation. It's good to have wall-to-wall carpet. Why? Because that will dampen the sound again. How about colors? The suggestion is don't just use stark white and have nothing on the walls. What we ended up doing, since the church had already made it stark white, is that we used a border along the top. A limited number of licenses or degrees on the wall. You don't want to cover the entire place, but the idea is you're saying what? I do have some qualifications for what I'm doing. Even if it's just a certification from us or something like that, there should be something in your wall to tell them that you have some qualifications. A clock that's visible to the client and to the therapist. And it's good to have it like someplace in between so they can turn and look at it, but they can't really see that you're checking the clock all the time, because what do they think when you're checking the clock? Yeah, you can't wait to get them out of there. You don't want it to be pristine, and you don't want it to be sloppy. You want it to be comfortable that they sort of fit in there. You, of course, still need a locking file cabinet or something for your records. Later on, when we talk about HIPAA, you're going to find out that there's some very stringent requirements under HIPAA exactly what you need. But a locking file cabinet will do to start. Some sort of a phone system. The way we operate our phone system is that we have it turned off to only take messages, but it flashes. So in between sessions, if I have any incoming calls, I can pick those up. And of course, we'll talk later, you're going to need some sort of administrative help to answer the phones when you're actually in session. You'll need a computer, a printer, and a fax. Someplace. Doesn't have to be in your office, it'll be in the church someplace. You need access to a credit card terminal. If you don't have that, you could actually sign up for PayPal and actually do it on your computer. Bookcases for the different books, because guess what's going to happen? The more books you read and the more courses like this you take, the more books you're going to have that you're going to want to have access to. It also makes it look like maybe you're smart or something. One of the suggestions they say in your textbook here is, when you get the whole thing set up, go sit in the chair of the client and see what they see. Because if they just see a bunch of clutter and a bunch of junk, maybe you need to clean the place up. Or maybe if they see dust on everything, you need to clean the place up. But it's good to see it from that perspective. That's your office. Next, a waiting room. You need some place for them to wait. In our particular case, this is just really sitting in the lobby. We put like 3 chairs out there and a little, some magazines that they can read and things like that. And of course, we have an administrative office that's right off that. So people can talk to the administrators and they can get their paperwork and they can do what they need to do. And that's an ideal setup. Are you going to have that in every church? No, but where would you have that in most churches? They're going to have a waiting area that the pastors use, that their administrator uses, and if they'll allow you to use the same waiting room, that works out just fine. In larger church, you might have everything you need if they're willing to work with you there. Your book suggests you have a white noise generator if it's too easy to hear from the waiting room what's going on in the counseling rooms. A clipboard for filling out forms, a bulletin board for required notices. The more we get into this and more into the legal stuff, you're going to find out there's notices you need for everything, and you have to have policies posted and all that. So a bulletin board someplace would be useful. And then an administrator's office eventually. If you don't have an administrator, you don't need one, right? But when you do, you need to make it so they can work out of there. Again, a phone, access to the people waiting, desks and chairs, secure storage for money, financial records, and counseling records. An area where books and other items can be available for sale, computer, printer, and fax, and credit card terminal. What's one more thing you're probably going to want as you begin to grow? A group room. A meeting room where you can meet with several people, and this is especially the case if your office isn't large enough to have a big family or something like that, but primarily you're going to want to run some support groups, or you're going to want to run some therapy groups, and so a group room that has maybe 10 chairs or something like that would be ideal, and a table, and things where you can run your groups, and of course that needs to also be soundproofed. Some decoration. We don't want things to be totally sparse. As you start growing, you're going to want to have an administrator. Why? Well, hopefully you're charging more money than the average person, and therefore it'd make a lot more sense if you have more clients that you could spend more time with your clients, and you could have somebody else that could do the administration work. And we found out earlier that not too many of you are really into the administration, the business stuff and everything else, and really like to do that anyway. So why don't you hire some detailed person that is going to do that for you? Now, what we recommend here is, if at all possible, get somebody else that's already a counselor that's starting that may be willing to do administration, and they will know how to handle people and deal with them on the side. So be someone with some counseling background would be very useful. What we recommend is that you start with somebody that's part-time, and if possible, you negotiate with them that what they make is based on what you take in. So therefore, it's a percentage of what you take in, because the more work they have, the more they ought to be paid, and so on, and that means you're not going to have some overhead that you're not going to be able to meet. Build procedures as you need them. We're willing to loan you some of ours and get an idea what we have, but you build your own as the need comes up. You write procedures and you put them down. Have accountability in monthly reporting. If you don't, what could happen? You maybe don't even know if your bills are getting paid or not. If the person says, well, I got it all taken care of, maybe they don't have it all taken care of. Maybe they're running behind, maybe they're a good codependent, so they feel they have to keep you happy, so they don't want to tell you that you're not making enough money, and so they're not paying your bills, and you got all these credit card debts that they're running up and all these other kind of things, because you don't have an adequate method of reporting. So we recommend you need a monthly accountability reporting showing you that all the bills have been paid, showing you that how much money came in, how much money went out, exactly what your status is. And we recommend that you even have that after you've been in business for a year, that you then compare last year the same month with the same month, so you can see if you're going up, if you're going down, how things are going. You check to make sure everything has been taken care of, because you only get what you inspect. And so it's your job to do the inspection to make sure that you have a handle on things. Don't hire friends. Why? Because it's hard to fire friends if they're not performing. And of course, we're suggesting here again you do it via contract versus an employee where they're providing a service for you, but that means that you can terminate that and go on to somebody else if you need to. We suggest the ministry concept model again. They're in ministry with you. You find somebody that really wants to do something for God that is willing to grow with you. Do not do your assistant's job. We all want to be nice, don't we? And we want to keep everybody happy, don't we? Well, if you hire somebody, you need to let them do their job, because it really shows disrespect for them. How are they going to take it? You might be taking, well, I'm being the good, nice boss, that I'm your friend, and all of those kind of things. But how are they going to take it? You think I'm incompetent. You think I can't handle it. If they can't handle it, then you give them more training. Or you switch which jobs they actually do. Do give promotions and bonuses, because if you get somebody already trained, it's going to be a lot harder to find somebody else. Do show your appreciation. Give opportunities to advance or take on other ministries. With our administrators, they're counselors also, so we try to find them more counseling niches, and they do counseling to make additional money from their counseling. We all sort of work together, we just have different jobs. If they're a contractor, you must treat them as a contractor. Let me explain what that means, because we've talked about contractors here quite a bit. According to the IRS, contractor is someone you're contracting for what they perform. See, as an example, if we're contracting with you as a counselor, it means we're hiring you to do the entire counseling job. Okay? If you're an employee, then we're hiring you to do what we tell you to do. We'll have to evaluate you. We have to pay workman's comp. We have to deduct your taxes. We have to do all these employee type of things. A contractor you're going to treat more as an equal that you're hiring to come in and help you. An employee is someone who works for you. How about policies? Well, the first thing is you're going to have to work out the profit versus service thing, like we talked about last time. Because if you just want to do service and you never bring any profit, you're going to be a part-time counselor for the rest of your life. If you're only interested in the profit, how are people going to think about it? Is that going to represent Christ? No, it's the heart of the person that counts, but still it has to work someplace. And as we have said, in the church environment, that can really be a problem, because a lot of people in the church think the counseling ought to be free. What do you say to that? Like one person said, well, you shouldn't have to pay for love. And the answer is, no, you're paying for my expertise, and you're paying us to be able to minister to you. The love is free. You must be in control of the profitability of your business, and you then provide a tenth to the church to provide for the facilities and that kind of thing. Dress. How should you dress as a counselor? Like your lowest client? No. But should you be wearing a tie? Should you be having a three-piece suit and everything you do? Now, the suggestion is someplace in the middle, that you look professional, but you look like someone who they could actually talk to, someone who's not going to jump on them, somebody who is going to be able to care for them. And, of course, a lot of pastors are even doing that today. So probably some sort of generally business type attire, but not too stringent like a tie and a suit and that kind of thing. Standards of conduct. What should be your standards of conduct? Well, they need to represent Christ, don't they? Do you think you ought to be going out drinking if you're a drug alcohol counselor? There are different areas that you might have to take on that maybe you believe are perfectly okay. What does the Bible say? It says, don't make your brother stumble. So it's your job to not do things that are going to make the person stumble. But we have a whole standard of conduct that we have for our counselors. Good practices. Some of the ideas and what I'm going to tell you now come from therapist consultants that operate out of Broken Arrow, Oklahoma, and they are actually professionals. You can hire them and they'll come in and help you get your practice together. But what do you think their slant primarily is? Business. They're going to try and make you profitable. They're going to try and make things work out. So they have more of a business slant. So I'm not going to recommend all of these things, but I want you to think about them and decide what you would want in your own counseling center. One of the things they say is you need to answer your phone live, or somebody to answer your phone live. They say with that you'll get about a 10% increase. Now why do you think that is? When people are looking for a counseling center, what do? They go to the phone book, or they go to the internet, or they go to their list they got from the courts, and they call somebody. And if they don't get somebody, what do? They go on to the next person on the list, right? Unless they've been recommended to you or something or referred to you, they're not going to continue trying if they don't get a hold of somebody. So that's why our recommendation is you have somebody at least on a cell phone that they can get a hold of. And realize when you're first getting started, it could be your husband. It could be your wife. It could be one of your kids. But have somebody answer the phone. If you're in a church, maybe it's the secretary of the church that can answer the phone. And then they can refer to you, or they can take a message or whatever. But it's better if they know and they can answer all the questions. They suggest at least 6 hours a day you need your phone answered. Because it's a cell phone, we actually have our phone available from 10 in the morning to 7 at night for people calling to try and do scheduling and those kind of things. Call the day before. This is really important. How many people forget their appointments? A lot of people. And so if you'll call them the day before, and our administrator likes to do it around 6 o'clock at night because otherwise people forget. They also suggest you have an advance package. What they mean by that is that you have a lot of your forms that need to be filled out. You put them on the internet, or you send them out by the mail to your clients before they arrive, so they already have a lot of material filled out. Another very important thing is, how do you schedule your sessions? I have to admit that I tended to be on the too nice side, which meant that I would just keep talking to people and so on. And so I would fill up the entire hour, and I wouldn't get any of my charting done. And at the end of the day, I would have to do all of my charting, which could take 2 to 3 hours. What time do you think I was getting home at night? 11 or 12 o'clock at night? A normal counseling session should be 45 to 50 minutes, which gives you 10 minutes to do your charting, or 15 minutes to do your charting. And I'll tell you what, you can do a whole lot more if you use that particular type of a schedule. So we schedule everything on the hour. How about emergencies when they overrun? Well, just means my 10 minutes or my 15 minutes gets taken up, and I'll have to do the charting at the end of the day and get caught up if I have some sessions like that. Some people will go and have longer sessions for assessments. We don't do that. We'll just go and spread our assessment out over 2 sessions if we need to. Build in breaks. We don't actually do that. Our breaks, the way I operate is I counsel here Tuesday, Thursday, and Saturday. And so I'm doing other things like on the internet or administrative stuff Monday, Wednesday, Friday. So I get my breaks every other day. Some people will build in time to eat or time to take a break in between your sessions. What we find is that we get enough cancellations or late cancellations or no-shows that I get breaks anyway. And if not, if I go 8 sessions straight, then I try to keep up as much as I can at 45 minutes at a time, and I finish up the rest at the end before I go home that day. So we don't get behind that way. Limit your client load, but have room for emergencies. The way we operate here is that if we have an emergency, I will either see them the hour before I normally start or the hour afterwards, either 12 noon or 9 o'clock at night. Schedule to prevent burnout. You have to be able to maintain this for the long run. This is not the 50-yard dash. They suggest that you greet them live. What I will do is I walk out of my office and I greet them and bring them into the office, usually. Sometimes if I'm busy or something, my office manager might have them come in, but I prefer to greet them live. They have a 24-hour cancellation notice. They recommend you charge if people miss. We don't do that again. Keep up on your charting. If you don't, you can't put it off till the next day. You're not going to remember some details. Schedule a plan and progress report after 10 sessions. This is a good idea so people are on track of where you're going and what you're doing, so they feel like they're making progress. In that session, you sort of talk to them and say, well, where did we start from? Let's see where we're at now. Now what would we like to do? And that's a good thing to do. Diversify. Try to have some other things than just straight one-on-one counseling. Do not isolate. It's real easy for people to isolate, to really just get in your own place and you're just doing your own thing. You're not talking to anyone. You're not doing anything. That's not good. You need to know other counselors. You need to spend time with other people. You need a life. Of course, you need continuing education credit. Even if you're a Christian counselor, it's not legally required. If you don't grow, you're not going to have anything to give your clients. You'll just be doing the same thing over and over and over again, and you're going to get bored out, bummed out, or whatever after a while if you're doing the same thing over and over and over again. Of course, you have different clients, so it is different. But as you get new clients in areas you don't know as much about, you need to learn and get into those things. Read books, videos, whatever you can get your hands on. Take vacations. See, what's the problem with this whole thing? If you take a vacation, do you get paid? No. So what's the temptation? Don't take a vacation, but you need a break. If you don't take care of yourself, if you don't get input, if you don't get spiritual input in your life, if you're not constantly in the Word of God, if you're not constantly going to church, going to seminars, doing other things and getting spiritual input and growing yourself, you can't just give out without taking in. You only can give out what you take in. So your spiritual life has to be robust and has to be growing if you're going to do this in the long term, and that's what we're talking about here. Billing. They suggest you collect at the beginning of the visit. We usually don't do that. We keep it on the computer and we let them know periodically, or we bill them or whatever. Another way of doing it, now it depends on your clients. What do you think the chances are that you're going to get drug alcohol clients or domestic violence clients to pay later on? Probably not too high, especially if they're court ordered. So the way we operate in our drug alcohol area is that they pay in cash each session that they come in. If they have insurance, we will bill their insurance and we'll refund the money when the insurance pays. We don't do that with other clients, but in that particular case, there's enough manipulation, other stuff going on, you almost have to do that. We use a credit card form. This is one of their recommendations. We haven't had too much success with this, but in some cases it would be very useful. We try to get them fill out a form, and it basically just says, would you give us a credit card so in case by the end of the month you haven't paid, we will just bill your credit card, and that way you can pay it over a period of time if you need to. And for some people, they're open to that, and that's one thing that we're trying to do. It has saved a lot of money. If we could have billed some people that either moved or something else happened, we have a way to bill them. Billing monthly or after therapy is over. Every other week we figure out how much they owe, and I have a little note there, and I just say, just want to let you know this is what your bill is at this particular time. We'd appreciate it if you'll pay your copay at least in advance or start paying, because we don't want to be part of your problem. We want to be part of your solution. So we don't want this bill to get too high that you have a problem with that. Now what they offer is an advance payment reduction. If people want to buy and pay for 10 sessions in advance, you give them 10% off. And they suggest you charge for consultations. We don't usually do that. We usually say don't call us at home unless it's an emergency or something like that. And we usually aren't very stringent on that. We'll help people to a certain degree, but we usually say don't call after 10 o'clock at night unless it's a dire emergency. What are some of the standards that we need in a counseling center? Well, quality determines people's expectations. If you walk into an office and the office is sort of all trashed, what's your expectation? This person hasn't got it together. It's sort of a trashy, they have a trashy life. Can I really expect them to keep my confidentiality? Can I really expect them to know what the heck they're talking about? So again, your environment needs to come across that you know what you're talking about and you have things together. So you need some established policies, you need written policies, and if possible, post them on your bulletin board. And you want to make termination a positive experience. Usually what happens with us is people get better and better and better, and eventually we start once a week, then we go to every other week, and then finally we really don't terminate. What we really say is, okay, if you need us, if something comes up, give us a call, we'll fit you into the schedule, but we're not going to schedule you bi-weekly anymore because you're doing well. Of course, we only do that when they are doing well, so we usually don't have a termination in that particular way of seeing things. Record keeping. Now this is where we have to get sort of serious, okay? And what I'm going to do in record keeping is I'm going to read you the law. Now this law is a law for a licensed marriage and family therapist or clinical marriage and family therapist with the Behavior Sciences Board. Now if you're a Christian counselor, do you come under that? No. But these would be sort of the expected standards that people have. And we want to look at those standards, and we want to make sure that the formulas that we use and the things that we do at least meet these minimum standards. So I'm going to start by reading you the law of what they consider unprofessional conduct. This is Kansas Law 102-5-16. Unprofessional conduct regarding record keeping. The failure of a marriage and family therapist licensee or clinical marriage and family licensee to comply with the record-keeping requirements established in this regulation shall constitute unprofessional conduct, which means you could lose your license, which means someone could use this possibly to try to sue you or other things like that. Content of marriage and family therapy or clinical marriage and family therapy records. Each licensed marriage and family therapist or clinical marriage and family therapist shall maintain a record for each client or client system that accurately reflects the licensee's contact with the client or client system and the results of the marriage and family therapy or clinical marriage and family therapy services provided. Each licensee shall have ultimate responsibility for the content of the licensee's records and the records of those persons under the licensee's supervision. These records may be maintained in a variety of media if reasonable steps are taken to maintain confidentiality, accessibility, and durability. Each record shall be completed in a timely manner and shall include the following information for each client or client system. And we'll be looking at forms a little bit, and you're going to see that we have to make sure that each one of these areas now has to be covered in your forms and the stuff you fill out. Adequate identifying data. The date or dates of service that the licensee or licensee's supervisee provided. The type or types of services that licensee or licensee's supervisee provided. The initial assessment, conclusions, and recommendations. A plan for service delivery or case disposition. Clinical notes from each session in sufficient detail permitting planning for continuity that would enable another marriage and family therapist or clinical marriage and family therapist to take over the delivery of services. Retention of records. If a licensee is the owner or custodian of client or client system records, the licensee shall retain the complete record for the following periods of time unless otherwise provided by law. At least 6 years after the date of termination of one or more contacts with an adult, and for a client who is a minor, on the date of termination of the contract or contracts at least until the latter of the two dates. 2 years past the date in which the client reaches the age of majority, or 6 years after the date of termination of the contract or contracts with the minor. So what are the forms now? I'm going to spend some time looking at the forms. We're not going to go in detail. I'll talk about our forms a little bit, and of course we recommended to you, but it's an optional book for this class, the Clinical Documentation Source Book by Weiger, because it's going to give you all of the forms, more forms than you want probably, in excruciating detail, and they probably have been made up by a lawyer. Again, let me mention, I am not a lawyer. This is not legal advice. This is how we operate, and we're doing the best that we know to operate according to the law and so on. First, you have an intake form. What are the critical things on the intake form? Now, your textbook actually gave you a whole long list of 19 different things, but I would say the critical things are the complete name, the address, phone number and contact, birth date, gender, emergency contact, relationship status, and then there are a lot of other things that would be really good to get, like any medications that they're on, any medical treatment they've had, past counselors they've had, and all of that information you want to get. And that's the first form. We'll call that an intake form. The next form, and this is the one that covers most of that law, but I'm going to add some more things to it from another part of the law, is informed consent. And this is the one you definitely need and you always have to do. And we'll take a look at that, okay? This is what the law says. This is unprofessional conduct again. Failing to advise or explain to each client the respective rights, responsibilities, and duties involved in the marriage and family relationship. Failing to provide each client with a description of what the client can expect in the way of services, consultation, reports, fees, billing, therapeutic regime and schedule, or failing to reasonably comply with that description. So if you tell them and you don't do it, you're also in trouble. Failing to inform each client, student, or supervisee of the limits of the client confidentiality, the purpose for which the information was obtained, and the manner in which the information may be used. So do you see all we have there? Now we're going to find out, if you go to the Clinical Documentation Source Book, that's going to be like 5 forms. So what we have done here is we've put that all together into one informed consent form. And I'm just going to show you what ours looks like. I'm not going to read it all to you, but I'm going to show you the general things you need to have in the informed consent form. Ours is called Counseling Agreement and Treatment Contract. This letter outlines the counseling agreement between Word of Life Counseling Center and or associated Word of Life Counseling's addiction treatment programs and the client. Our desire is to assist you and your family in achieving a fuller, more abundant life, and more specifically, your agreed upon selected counseling goals. We provide Christian, marriage and family, addictions, and individual counseling to members of Word of Life Church, other churches, and the surrounding community on the following basis. Your rights as a client. All client information given here is confidential and will not be released to outside persons or agencies unless we have your written consent or that of your guardian. However, as part of this agreement, the client agrees to the release of any and all counseling information without another written release of information for the following reasons. As required by law, when homicide, suicide, child or elder abuse is involved, or in cases necessitated by a medical emergency. For consultation with other members of the counseling or pastoral staff, including spouses, the client's pastor or guardian, or for counseling supervision purposes. Now that's added in there so you don't get yourself into a trap that you're working someplace and the person divulges something that would be detrimental to the church and you can't talk to the pastor about it. You will not be photographed or otherwise identified in any media form without written consent. No research information identifying you will be released. You will not be observed behind two-way mirrors or on videotape or recording equipment without your prior approval. You will be informed of alternate means of treatment should you request it. You have a right to express opinions, recommendations, and grievances to staff without fear of prejudice or penalty. You will not be denied treatment based on race, religion, political affiliation, or sex. You have a right to participate in the formation of your treatment plan. Bills and charges will be explained upon request. We will respect your right to make your own decisions, but will attempt to help you understand the consequences of those decisions. You have a right to terminate counseling at any time without additional charges unless a specific contract requiring a specific number of sessions has been agreed upon. Clients may request referral to another counselor or agency if they believe that the therapeutic relationship is no longer effective. Do you see how I'm covering all that stuff that the law said in a very fast and rapid way to try and get this down to 2 pages? Responsibilities of the client. Deal realistically with the problem. Accept that there may be ups and downs in your treatment. Discuss any important life decisions with your therapist before a decision is made. Be responsible and open in your communications. Respect the confidentiality of other clients with whom you may come in contact. Be responsible for your own growth, which means work. Then treatment contract. Qualifications. Your counselor is not a medical doctor. It is not authorized to prescribe medication or prescription drugs. If medication is recommended, you should contact your family doctor or a qualified psychiatrist. Your counselor holds the following degrees, certifications, or licenses. Payment of fees. I'm not going to go into all of that, but basically payment of fees basically just says this is how we're going to operate. We will bill your insurance for you. If you want us to bill your insurance, we will bill you. If you have any problems with it, you can talk to us and we'll resolve those problems. Missed appointments, we do not charge for services not rendered. However, at least 24 hours advance notice of a cancellation is a courtesy that helps us planning and does not deny someone else an appointment. Consistent cancellations or failure to show may result in loss of your weekly appointment and necessitate rescheduling of your appointment when other times become available. Child care is not provided unless otherwise indicated for some support groups. However, if you bring your child, Word of Life Counseling Center assumes no responsibility for your child's care or safety. Parents assume full responsibility for any damages to the facilities, its premises, or injury to other children if present. Doctor consultation. If symptoms of a mental disorder are present, we are required to contact your physician in order to determine if a medical condition or prescription drug may be a contributing factor. You must provide the name or telephone number of your doctor and authorize us to consult with him or her or waive this requirement. And then I have read this counseling agreement and the attached AIDS information, that's if you're in a drug alcohol program, for the high-risk clients and agree to carry out all policies, responsibilities, and provisions therein. This is to be returned to Word of Life Center when signed, and their signature and their date. We normally give them to them, and we put that in their file to show that we have covered all those bases that were talked about above. Do you see how we've combined all of that? Said in your other book, you have many other forms that you can put together in doing that kind of thing. And I'm going over that one primarily because that is a critical one for professional conduct. Let's talk about some other forms now. Diagnostic interview form. We actually have a form that we use, and we use it primarily if we're doing an intake that we're going to pass on to another counselor like a lay counselor. It's called the Client Problem Assessment. And all we have on that is all the things I normally ask anyway. I might not be filling that out. It might be in the notes of the first session. But it's going to cover everything from the presenting problem to a list of all the possible issues that might come up, to a relationship analysis, information from the family of origin, spiritual assessment, attachment analysis, and conclusions and recommendations. And you see this little sheet where the recommendations is giving that initial analysis and initial plan that we're going to do with these particular people. So if you use this form, it's already taken care of for you. The next thing we have is the counseling plan. And this is one of the things that was listed that is required. But you can do it a number of different ways. One way that I'll do it many times is in my notes for the first session. I will just put in the counseling plan. You can use a form that we have in this clinical documentation source book for doing that. And the real point is you have to do it in detail. I'm going to give you an example from the clinical documentation source book of what not to do. What they recommend on this is you break it down between problem and symptoms, goal and objectives, and treatment strategies. Now this is the plan of what not to do, okay? This is the way it reads. This is somebody's plan. Problem or symptoms, depression. Goal and objective, eliminate depression. Methods, individual therapy and Prozac. See, do you really know if you're a counselor reading that what they're really doing? See, the problem is you need to have concrete details of what's going on and what you expect in these. Irritability, stop mood depression, therapy. Sadness, increase outlook, counseling. No, that is not adequate in the way of doing a counseling plan. What does an adequate counseling plan look like? Depressed mood. Develop a plan to alleviate emotional, occupational, social impairment due to depressed mood. Return to the previous functioning levels. Strategy. Individual therapy, cognitive behavioral, medical referral, possibly marriage therapy. Use a particular test. Do you see how it's more concrete? That's the main thing I'm trying to point out. You need a plan. It needs to be something somebody could look at and know what in the world you're really doing. Another type of form that we use is a signed release of information for the courts, lawyers, or whatever. All it basically does is it says that you release a particular thing, exactly what you release for a particular time, and that you can rescind this release at any time if you wish. Another form that we use, and you need one of these, is a consent for treatment of minors. If you have anyone under 18, you need to get their guardian, and it has to be a guardian, can't just be any adult, that agrees that you can counsel the person. But what happens if you have a divorce case and one of the guardians says, I want you to counsel him, and the other guardian says, I don't want you to counsel him? What do you do then? Unfortunately, you have to go with a negative. If they aren't in agreement, if they're saying, I don't want you counseled, you're going to have to go with a negative on that and not counsel the particular person. Now, how about progress notes? Again, you've got a form that we use. We use SOAP here. SOAP stands for subjective, objective, assessment, and plan. In your clinical documentation source group, they use DAP. Just call it data, and then assessment, and then plan. Again, here is a poor example of what not to do in your counseling notes. John was on time to his appointment, did his homework, took tests, talked about his homework, went over marital relationship, discussed events of the week and how they relate to counseling, was happy about talking to his uncle on the phone. That was what they would call the D. And we would break that between subjective, what they told us, and objective, what we observed. Their assessment: went over homework and made plans, worked on communication skills, positive communication is important, will come again. And then their plan: note, waived copayment if insurance pays its portion. That's illegal. So don't put illegal stuff in your notes. Don't go and just do general eyewash. This is not eyewash. This is something that another person has to be able to pick up and be able to carry out. Now let's look at a good one. What they call D, or the data. Completed homework assignment of identifying dysfunctional thoughts. Reviewed 5 positive qualities and 5 perceived negative characteristics from the previous session. Several self-depreciating statements. Difficulty believing he is capable of being happy. Described self as being easily irritated and less capable than most other people. Fairly upset about continued spousal discord. 2 divorce threats this week. Do you see how it's concrete things of what actually went on? And what I actually do is I just scribble little notes. No one could probably read them anyway, and that's not the official document. That's kept separately. And then I type this out after the session, and I try to make it concrete. And again, we use SOAP, which means we have what the person said, and then I have a statement, the person looked depressed, or something about the observations about what the person did, the person cried. And then we have assessment. This is what they consider a good assessment. Increase focus on personal responsibility for behavior, effective change, and in self-direction. Viewing self more positively in the past few weeks. Continued concerns with level of irritability and spousal discord. Progress in individual concerns, but low motivation in spousal issues and missing work. Complaint in homework assignment, but level of insight moderately low. So just an idea, this is how the person is doing. And then the notes. And I'll actually put stuff that I've done in the session that is part of the plan in the plan. Some people don't do that. Some people just put plan notes. Homework. Implement 1 out of 3 above listed short-term goals. Continue dysfunctional thought record. Client is considering spousal involvement in therapy in 3 to 4 weeks. Do you see how I'm saying? It needs to be concrete. Somebody else needs to pick it up and know what the heck you did and know what the heck is going on. Another thing you need, and we're talking about your facility again, is liability insurance. And we'll be talking about that in another session in detail, but generally you need $1 million, $3 million. That means that they cover you for $1 million per incident and $3 million for a group of incidents. You need to have liability insurance on yourself, and you need to cover your facility or the number of facilities if you have. You're working with 3 churches, you need to cover all of them as other insured. If you have your own facility, you need your own insurance. You need to even cover your facility. You have to have liability and someone falls and gets hurt, damage for the building, all of those other kind of things you have to cover under your liability insurance. Accounts and reporting. Later on, we're going to talk more about the financial software. My recommendation is, if at all possible, use what your church has. Form types. In your clinical documentation source book, they have intake forms, HIPAA forms. We'll be talking about HIPAA. Maybe it feels like it sometimes. Then they have screening forms. They have assessment forms, psychological evaluation forms, treatment planning forms, progress note forms, many other forms, including like a suicide contract and all of those kind of things. Chart review forms and termination forms. It's made from Microsoft Word, so you can just bring these forms up, actually fill them out on your computer, and we'll have some form to cover everything that needs to be covered. Contracts with the church. Now these are still important, okay? How do you do a contract with a church? And again, we have our own. We're not saying you need to do what we do, but I just want to give you an idea of what that might look like. Let's first look at the Word of Life Center agreement. Word of Life Ministries agrees to provide the following: all facilities and utilities, all equipment and office supplies, including telephone, fax, computer, copier, paper, stamps, except for large volume advertising or special needs. Reimbursement for any counseling approved by the senior pastor's benevolence. Free advertising in signs, church publications, and radio broadcasts. Church liability insurance for lay counselors and support group leaders. That's what they're going to provide us. What we're going to provide them. In exchange, Word of Life Counseling Center and Word of Life Institute will provide a tithe to the church for the gross income from counseling and money received from Logos and audits. Development and management of free support groups and a lay counseling program. Counseling training for lay counselors and student counselors. Administration of the Word of Life Counseling Center and Institute. Counseling liability insurance for the director and coverage for the church for all paid contractors. Pastoral duties by the director as an associate pastor of Word of Life Church. So that's what we're giving back. Then we explain the organization of Word of Life Church, which I'm not going to go over. And then we have the counselor and director remuneration policy. This just says what I particularly get. I get basically what other counselors get and what other instructors get, which is 70% of their counseling fees, 20% of the instructor fees, and I get a 5% gross income from counseling supervision. And then all the other kind of things, this is where you would put in if you want a 403B. This is where you put in if they pay for your travel and all those kind of things if you go to conferences for the counseling center. But basically all of this compensation comes from where? Out of the counseling center. None of it comes from the church. So we basically make sure that we are totally covered, and everything is on what? A percentage basis. So therefore we never go under, we never get behind, because everything is on a percentage basis. We're in a joint ministry organization, which means we all sink or swim together. So to see how that is. Then our contract with counselors. Again, Word of Life Ministries agrees to provide basically all the facilities and so on. In exchange, the contractor will provide. And this is a contract, meaning it's just the services they will provide, including managing, say, a program like the drug alcohol program, and so on and so forth. And then the organization, how this all comes together. Did I give you enough information? I'm not trying to overwhelm you, so I want to end by simply saying, what is the minimum that you need to do to get started? It's pretty simple. You need a facility, an office, secure storage, 2 chairs, and a phone. How about forms? You need an intake form, an informed consent form, a release of information, release of consent for a minor, a planning form, and a case note form. And that's all you really need to get started. All the rest of this stuff is going to build sort of automatically as you have needs. And if you have like the forms book and so on, you can always get their forms and use them. You can always get our forms and use them to get information of what to do, of how to put everything together. And the idea is what? Can you put something together with God's help that will be something that will reflect Him, that people will see through your counseling Jesus Christ and His love and His care for them? Let's pray. Dear God, we ask your help. We ask your direction. We ask your life. Lord God, that this wouldn't be just something of us, but be something of you that could be a blessing to many, many people. You'd help everyone in this class, Lord, to put together what you want for them to reflect you and give you glory in Jesus' name. Amen.